Good afternoon everyone. Today's topic of presentation is O-arm navigation in revision spine surgeries, initial experience and learning. Revision spine surgery has its own set of complications. The difficulties are primarily due to a distorted anatomy after previous surgery. Knowing the anatomy and a detailed intraoperative bony and soft tissue relation can help in alleviating the problems. With the advent of O-arm, it's possible to precisely know the bony anatomy intraoperatively. Objective of this study is to assess the utility of O-arm navigation in revision spine surgeries and to analyze its effect on complication rates. So a retrospective review was performed on 18 patients who underwent revision spine surgery under O-arm navigation from period of July 2020 to December 21. These patients were grouped according to the type of primary surgery and present pathology. In each group, intraoperative anatomical difficulties, aid of O-arm and navigation to overcome those difficulties and prevention of possible complications was assessed. So they were grouped into 5 groups. Group 1 included patient operated with discectomy decompression and presented as recurrence. Group 2 included patient operated with interbody fusion and presented with adjacent segment disease. Group 3 included patient operated with posterolateral fusion and presented with ASD. Group 4 included patient operated with fusion and fixation in osteoporotic spine and presented with implant failure and deformity. Group 5 included patient operated with as a spine surgery presented with infection. So illustration of group wise cases. So this case belongs to group 1, 54 years male, has history of previous L4-5 laminectomy decompression at 9 years back and 3-4 laminectomy decompression 8 years back, presented with recurrence and instability. So in this case, navigated probe was used to assess the extent of laminectomy and bone defect. It helped to limit the medial dissection and avoided dural injuries. So in this case, L3-4 and 4-5 T-leaf was done. This was the post-op X-ray. Case 2 included group 2. Here the 61 years female with the history of 7 years old operated L4-5 T-leaf presented with adjacent segment disease. In this case, 3D CT scan helped in assessment of accurate cage positioning and the status of the previous implant. Navigation probe used to assess the extent of laminectomy and facetectomy. This was the post-op X-ray where L2, 3 and 3, 4 revision T-leaf was done. Case 3 included group 3 where 66 years male with previous history of L2, 3 posterior instrumented stabilization 5 years back and L5S1 decompression 3 years back presented with adjacent segment disease. In this case, navigated probe entry owl was used to locate the exact entry point for a pedicular screw over posterolateral fusion mass. This avoided misplacement of the pedicular screw. This was the post-op X-ray. And in group 4, 65 years old female with a 1 year history of D12 osteoporotic vertebra plana with implant failure. In this case, entry owl was used to assess the exact pedicle entry point and trajectory to avoid multiple attempts in deformed and osteoporotic vertebrae. And this was the post-op X-ray. Results of the study: in group 1 and 2, navigated probe was used to assess the extent of laminectomy facetectomy defect which prevented iatrogenic durotomy and nerve root injury. In group 3, navigated probe and owl was used to locate accurate entry point over posterolateral fusion mass, preventing the misplacement of pedicle screw. Group 4, navigated probe, owl and tap was used to determine the trajectory of pedicle screw in rotated vertebra or pedicle. And in 5, navigated probe, owl tap was used to determine the alternate trajectory bypassing destroyed bone, attaining maximum pull-out strength. On conclusion, O-arm navigation is a boom when it comes to revision spine surgery. Adjacent segment disease to infection, the spectrum of its use has its own special importance. We would recommend the use of O-arm in revision spine whenever possible, thereby improving the accuracy of the surgery and reduce the complication associated with it. Thank you.